Hello everyone, welcome to my channel. In today's video, I am going to discuss the case notes of Mr. Ming Zhang. This is a sample letter for nurses. For OET writing subtest, initially you will be provided with 5 minutes reading time followed by 40 minutes writing time. Initially, we need to understand what is our role and to whom we are writing this letter. From this writing task, we can understand that our role is a charge nurse and we are writing this as a referral letter to the local community mental health team. From these notes, we can understand that Mr. Ming Zhang is admitted in a ward where we are working as a charge nurse. We also can understand he is 24 years old, he is from China who speaks less English and needs an interpreter. His admission date was 5th April 2011. His discharge date is 26th April 2011. His diagnosis is major depression and deliberate self-poisoning. He came to Australia as a laborer 5 years ago. Permanent resident now. Wife had affair and divorced patient 1 year ago. Depressed and unemployed since. Lives in own house with NESB. Mother out from China. Mother doesn't like patient taking psychiatric medications due to her Chinese medicine belief. Patient hobbies are fishing and online trading. Patient's psychiatric and medical background. No history of depression before divorce. First presented 1 year ago with first episode of DSP and major depression. Attended Chinese psychologist sporadically this year. Current presentation is second DSP and mental health admission. Medical history of gout, previous hepatitis A, fracture of left tibia, fracture of right humerus, fracture of left clavicle. All these incidents happened in separate occasions which were resolved now. All these incidents were related to his work. His medication is mirtazapine 30 mg at night. Nursing management and progress. He was frequently seen by Chinese-speaking transcultural mental health worker and received 1:1 CBT counseling. He had insomnia and decreased mood. His mirtazapine dose increased from 15 mg to 30 mg on 12th April 2011. Mother educated via interpreter regarding importance of antidepressants. No suicidal ideation at present. Please monitor closely for suicidal ideation in community. On assessment, patient mood was low but improved. Low risk of self-harm with close follow-up and support. Good response to CBT. And the discharge plan for Mr. Ming Zhang is case management through the community mental health team. Ideally assign patient to the Chinese speaking clinician or use interpreter service. Continue CBT. Observe response to antidepressants. Monitor for side effects. Encourage physical exercise and job hunting. Avoid prescribing benzomedications as patient is using these medications for DSP. Here comes the sample letter. The letter starts with today's date, 26th April 2011, followed by the address part. The team leader, local community mental health team, right community mental health team. The main thing in address part is every word should start with a capital letter. Next comes the salutation. As there is no name given in the address part, we are writing Dear Sir or Madam, referring Mr. Ming Zhang, age 24 years. Next comes the purpose paragraph, in which we will be writing patient's full name, his current issues, and for what we are referring the patient, along with his discharge status. Next comes the assessment paragraph. Mr. Zhang was admitted on 5th April 2011 following a second episode of self-poisoning due to his diagnosis. Initially, it occurs 1 year ago following his divorce. On admission, he was found to have insomnia and disturbed mood. Therefore, he was administered with 30 mg of his usual medication, metazifine, and undergone cognitive behavioral therapy, which needs to be continued. As Mr. Zhang's mother is not interested in psychiatric medications, importance of antidepressants were educated to her. Currently, he has no suicidal ideation, however, it needs to be monitored. Social history of Mr. Zhang. Mr. Zhang is a laborer who migrated from China 5 years ago. Currently, he lives with his mother, who has no basics in English language. He has been depressed and unemployed since his wife got divorced. His hobbies are fishing and online trading. Next comes the recommendation paragraph. Kindly take over the case of Mr. Zhang and observe his response to antidepressants as well as any side effects. Kindly encourage him to do physical exercise and search for job. It would be beneficial if you could avoid prescribing benzomedicines as he uses these medicines for self-poisoning. Please assign any Chinese speaking clinician or interpreter service for him. And the last one is conclusion paragraph. If you have any queries, please do not hesitate to contact me. Finally, completing the letter with the signing off. As they didn't give any name and address part, we are writing yours faithfully, charge nurse.